Hello. So today's Monday the 8th of March, and I did quite a full-on day on the acute medical unit. So if you remember from my last video, I do 1 day a week providing educational support and registrar support really on the acute medical unit. But Monday being after the weekend is usually busier, or can be the busiest day on the unit often. So this morning I decided to go around and support the post-take ward round. So these are patients who are on the acute medical unit. They've already seen a consultant on their admission and they just need ongoing review either by a consultant or a registrar. So I decided to use this as an opportunity to try and provide some education. So we saw some quite interesting patients actually, and we did lots of teaching around one of them had shortness of breath secondary to heart failure. Another had pericarditis, which is an inflammation of the lining of the heart. It was some very good general medicine. I was expecting to sort of encounter quite a lot of COVID, but they're quarantined in another part of the unit, who was seen by another junior doctor. So I actually got to do some nice general medicine. So it was nice getting back into that actually. And one of the things I realised is I actually haven't forgotten all the medicine I thought I'd forgotten. It all came flooding back. It was as if it was yesterday I was last on the unit. So that was really nice. And I think the junior appreciated having somebody go around and provide some plans as well. We saw a really interesting case of somebody with myelodysplasia, which is a condition where your bone marrow doesn't make all the components like your white cells and your red cells. And interestingly, he's had his COVID vaccine, and we were discussing about whether patients like him who are immunosuppressed would actually build antibodies, and it seems he has. So he was really happy about that. And you know, the last time I was actually seeing patients in hospital, apart from last week, COVID wasn't really a thing. So you know, it's interesting having these discussions. We did have a really interesting discussion. So everyone who comes into hospital, we must discuss resuscitation status. And that's really a joint decision between the patient and the doctor. This was my practice even well before COVID. So I was asking everybody about what we should be doing. And I'm really clear with the patient that it's not about age. It's actually about all the medical problems and the success of restarting the heart. And he actually told us that he watched a lot of hospital dramas. So unfortunately, it's really difficult. It's not the first time this happens where you then have to disillusion them of the fact that actually resuscitation, unfortunately, is much more brutal, if I'm honest, than it is on TV. We often don't use paddles. We use pads, in fact, if we want to shock somebody. And unfortunately, there's been a lot of bad press, as you know, with the feeling that people are being advised or told that they're not going to be resuscitated because of the COVID situation. I don't get this feeling that's certainly happening where I am. But nevertheless, you know, some of these patients have lots of medical problems, and you have to really balance whether his heart, his or anybody else's heart's actually going to sustain that sort of trauma if you're going to jump on their chest. So that was really interesting to do and go through that. And actually, I think me and the patient decided he would think about it, talk to his family, because it's not something anyone had actually discussed with him yet. And, you know, that's what we did. There was no imminent reason to make this decision now. But I think it is really important. I would really urge all of you to actually discuss your feelings, you know, with your families, if you can. It's not a nice conversation to have. And sometimes the first time a patient even thinks that this might be something we might need to discuss is when they come into hospital. But actually, it reminds me of my own mortality. So hearing, you know, we've all heard about the amount of people that are dying from COVID. And with my daughter at home, it sort of hit home that it made me think, what would I do in that situation? And I'm not going to go into what I would actually do, but it does make you think about that, and it makes you think about what you're going to leave behind. And my mind sort of trailed back to my daughter, who, you know, is only 7 months. And it's not something I've really had to think about before. Other things we did today. So I supervised one of the junior doctors do a lumbar puncture. So that's a needle into the back. to try and get some fluid off. There was a concern that this patient had meningitis, so that was interesting. And again, my skills of lumbar puncturing are actually still there. I've done quite a lot to be able to supervise, and the concern is always that you're going to forget how to do them. So that was really, really good to do. I like doing procedures. They're satisfying, and if you can get a diagnosis on top, then that's even better, isn't it? And then actually ended up talking to one of the junior doctors about her career and my career pathway. So I've taken quite a weird career pathway. I haven't gone straight through. I've taken time out to do really education and leadership stuff, which I really enjoy. And actually it's given me a bit of time to think about what I want to do within gastroenterology. And I know I want to be a liver specialist, and a lot of my week is going to be sort of gearing myself up for applications for that. But one of the things that sort of was quite funny was my husband realised that he didn't have the mirror for to see the baby at the back, so he had to come and make a stop, and I got to see my daughter, even though I didn't hug her, obviously didn't touch her or anything like that, sort of saw her at a distance. But it made me realise how much I do miss her when I'm at work. But I balanced that with how important it was that I did go back to work when I did. It was important for me to go back to work to keep my sanity. It gives me a balance. I think sometimes we can feel a bit guilty about going back to work when your baby's this small, but actually the way I see it is I'm doing it for her. I'm doing it so that I can give her a good life, and that she can see her mum going to work and being a mum and being able to do that. So I think that's my reflection, really. That's my main point of today is, actually, if you feel like you need to go back, don't feel guilty about it. Everyone makes decisions to stay longer or to go back for their own individual reasons. And sometimes you can be made to feel a bit guilty about going back a bit early. Don't. And likewise, I know people who have been away for a year or so, particularly during COVID, and they can sometimes feel a bit guilty that their colleagues are still dealing with that. But actually, your time will come to give back to the NHS, and actually the time you have with your children is so precious that you don't want to give that up. So I'll leave you with that for today. Tomorrow is going to be a very exciting day in that I'll be doing some endoscopy and seeing some liver patients, so that's a different environment to what I've been doing, and so I look forward to talking to you about that tomorrow. Otherwise, that's it from me. And as always, if you have any comments about how to make this more accessible, do let us know, or do comment below. Bye-bye for now. Hello, guys. So today is the 9th of March, and today was an interesting day for me. I'm doing my vlog from my bedroom today, purely because I had quite a long day. I cycled back and unfortunately fell off my bike during the journey, and actually only had an hour with Lily, so I wanted to spend the evening with her. So you're getting my vlog a bit later. So today was actually a bit harder than most of the other days, because I've been able to come home at sort of a normal time. But today I did an afternoon clinic, a liver clinic, and that finished at 5:30. And because I'd cycled, I didn't actually get home till 6:20. So Lily had already had dinner, and we had a bit of time in the evening, but then it was time for her bedtime. And I realised how much I actually missed her. And it wasn't although I really love being at work, that side I hadn't really thought about as much. And even though I get my mornings with her often, I'm getting pictures sent from my husband about what a lovely time they're having. So it did really remind me that it's really important that I keep my Wednesdays free for her. So tomorrow we've got a walk scheduled with a friend, which will be really nice. So today, I did my cycle, so I've started cycling, and one of the things I sort of forgot about, or didn't really think about, is how I was going to get my exercise in. So before I had a baby, and before COVID, I was going to the gym, I was running, and you could just go whenever you wanted to. I did a bit of pregnancy yoga, and Bob's your uncle. But I've realised that I can't really just go out for a run whenever I want. So actually, I've just started cycling to work. I live 5 miles away. And if COVID hasn't taught us anything, one of the things we have seen is how much the environment has
changed a little bit for the better, because people are staying at home. So I thought I'd try and carry that on. I don't plan to cycle when I'm on call, but certainly if I can cycle to and from work when I'm in Gloucester, that's better than nothing. So just having to have that foresight was, you know, something I hadn't really thought about. So I actually had a bit of a free period, as it were, just because of the way my job is. So I've been revising for a gastro exam. So you'll be surprised to know, or maybe not surprised to know, that pretty much every speciality has their own exit exam. So it doesn't end at medical school, unfortunately. At the moment, I'm having to fit in my revision when Lily's gone to bed. So generally I get about an hour or 2 hours. It's better than nothing, really. But I actually got to get some solid hours in, so I did a few hours, and that was nice. So I then had a meeting with one of the consultants. So one of the things they're trying to set up is what they're calling endoscopy academies. So for those lay people who aren't familiar with endoscopies, these are camera tests, either gastroscopy, so through the mouth into the stomach and part of the small bowel, and colonoscopy, looking into the bowel, and there's lots of other endoscopy tests. So one of the things we found, particularly with COVID, is many of the gastroenterology registrars got moved on to quite heavy COVID rotas, which meant that they lost a lot of that training. So this is a way to give them some more intense training, and we were discussing about how we can sort of make that work for the training registrars. So that was, you know, that's part of my leadership management role. So that's what, you know, that's quite interesting to get involved in, and I'm really looking forward to seeing how that develops, because I think it'll be really good for the region and for the trust. I then sat and had lunch, and actually it's just little things like, even though you're distanced and you can take your mask off, I actually tried to find a spoon and realised I'd forgotten my mask. So you're feeling really guilty, and you run back to your table, get your mask on, and try and get the spoon. And it's just because I've not been in that environment, it hasn't been ingrained in me like it has been for everybody else. And these are things they don't teach you in induction. So that was nice. And then I did this liver clinic, which I really enjoyed, and actually it made me realise a lot of the things that patients have been missing, that you don't really think about. So one of the patients mentioned to me, so she's trying to lose some weight, and she's been going to Slimming World, and those classes are gone. And actually going to those classes gives lots of motivation to these people, because of, you know, there's other people going through the same thing, and it takes me back to how I feel about missing mother and baby groups. So there are lots of things that happened in the early weeks and the early months that actually I can't, you know, when you're going to a weekly group, you're able to discuss those things. My NCT/antenatal class group, I haven't actually met in person, and even though we have a WhatsApp group and we talk a lot, it's not really the same as being able to have somebody to talk to. It made me realise that everybody in the country has missed out on lots of things, and it's actually brought that home just talking to this patient. So yeah, it was a good clinic. My consultant likes to see the new patients face to face, so I actually saw one of the patients face to face, and just again remembering things like putting your apron on and putting the visor on before you examine them. I just haven't been in that environment, so it's trying to get myself back into that routine. But actually I am sure in a couple of weeks it will just become second nature. And actually I realised that my history taking was probably not as sharp as I'd like it to be. I discussed the patients with the consultant, and even though the plans didn't change all that much from what was discussed, I did have to think a bit more about what I was going to ask the patient, but normally it just comes to me. So again, it's not something I really thought would happen, but it's the first time I'm doing a clinic for a year, so I think it's bound to happen. But I know it's going to come. By the end of the clinic, I felt a bit more fluent, and it was all coming back. And I love liver patients. I love the pathology. And actually I feel really useful. It's really nice, trying to sort of catch up with these patients sort of during COVID, and actually it's just remembering things like, have you had the COVID vaccine, and talking them through that. If they, particularly a lot of these patients have chronic disease. It's just getting back into that routine. And then cycled home, and unfortunately fell off my bike. That's bound to happen. It's just one of those things. I'm still going to carry on cycling. So yeah, it was a relatively busy afternoon, but really productive. Tomorrow's my non-working day, so there won't be a vlog. Or I might do a small one at the end, just describing what that just having a day away from the hospital is like. But otherwise, I'll be doing another one on Thursday. So until then, again, any comments about how to make these more accessible, please comment. I'm willing to make this better so that you can sort of follow what's happening. Anything you want to ask me questions about, feel free to either tweet me on @ShayBarney or comment below on the video. But until next time, have a good evening, and I'll see you again. Bye bye.
Hello, how are you all doing? So it's Thursday the 11th of March, and this is sort of a double episode, but it won't be very long. So yesterday was my non-working day, and I realised how tired being a mum actually is when you actually start back to work, and can now really appreciate why people go down to 60% less. I say less than full time. People forget that the days when you're not at work, you're actually working pretty hard. I've realised that work is actually rest compared to the days when you're not working. I do have to add a note here. I actually think I had concussion yesterday from the fall I had. Felt quite dizzy. And luckily was able to have a little nap with Lily, which was really lovely for 2 hours. But it means I won't be cycling again tomorrow. I'm going to probably wait till next week. And it gave me a chance to reflect just on, a few things really. So it's really difficult for me, it's really difficult to balance the stuff I want in my career and actually being a mum. So I'm really keen on ERCP and EUS, and I've been having lots of discussions about how I'm going to fit that into my training. So for those who don't know what those are, so ERCP is an endoscopy type test that basically looks into the bile ducts near your liver. It can help fish out stones, take samples if needed, etc. And EUS is another endoscopic test, but utilises ultrasound within it to try and you can see the gallbladder and pancreas a bit better. So I think I decided a little while ago that I was going to drop colonoscopy training in favour of this so that I could really focus on it. And one of the things that's come to light is having to make the decision that I need to do an extra year after I finish my training to really hone down that skill. And one of the difficulties is how I'm going to fit that in with being a mum. On the one hand, I want to keep myself sane. And if those things make me happy, then that's really important because she will grow up. But on the other hand, there aren't many places that do it, and I'm hoping that things will, there'll be more places near where we live that offer it. But at the moment, you either have to go to Bristol or Birmingham, really, and can't really go anywhere else. So it's given me a bit of food for thought, and the challenges that we face as parents, all of us as parents, is really, really difficult. But I am really determined to try and make this work, so I'll keep updating you about my progress. So today I actually was in an all-day meeting with the British Medical Association Junior Doctors Committee. So I sit on that just by virtue of being co-chair of our region. And really interesting stuff. I won't talk about it because most of it's confidential, but I did have Lily with me, and actually there are a few members on our committee who also have babies, and actually normalising that's really important, and remembering that a lot of us have lives outside of being a doctor. It reminds us of that. Being able to sort of input, thoughts that our region have. And particularly in terms of flexibility of training, I do find sometimes our training can be quite rigid, and we are making big strides, but there's much more we need to do. So that's a work in progress. So the other thing I've just realised that is I want to do a liver year because I want to be a hepatologist alongside the endoscopy that I just talked about. And originally my plan was to do this year after these 18 months so that I had time if I needed to move away to come back. It's now transpired that the society won't let you actually do it until ST6. I'm I would only be ST5, so you know, fifth year, I guess, of medical training. So that's put a spanner in the works, but again, it's just something I need to work through, and we are determined to make it work. But it does make you realise, as soon as you become a mum, you can't just decide on things. You have to really think it through and try and balance it, and that's really, really difficult. When I think of people in other professions, you know, my husband is not a doctor, you know, he's in a job that's permanent and they'll provide that training in-house. It's so difficult with anything we want to do, whatever speciality you do, because sometimes there are just some things that are just not offered in the region you're in, and then you have to make the decision to either move for a bit or sort of cut your losses. And that's difficult, actually. But I think it can work, and I'll keep you updated. So my little one's just gone to bed, so that's why I've come downstairs, so I don't disturb her. And I didn't want to do another webcam thing. I was quite keen to use the phone. So this evening I'll be revising again for my exam, so it doesn't really stop. This is the only time I can really get in some revision. Tomorrow is quite an exciting day. I'm actually going to watch some ERCP in the morning, just to sort of get a handle on how it's done. And then I'm actually sitting in a webinar all about liver disease and non-alcoholic fatty liver disease. And we know that as time's gone on, non-alcoholic fatty liver disease has is becoming more common. And just for those who, again, are not medical, this is a condition of the liver, can cause fatty liver, can cause scarring, normally associated with things like obesity, high blood pressure, cardiac disease in the background. So we know that though the incidence of those things is going up, and therefore non-alcoholic fatty liver disease, and we as hepatologists, not the hepatologists at large, need to think about how to sort of manage these and how we can work in, as a country to try and get a handle on that. And that's something I'm quite interested in, so I'll be sitting in that. So I'll give you some feedback about that. In the meantime, I will speak to you tomorrow. Again, any comments, please just put them in the comments and I will pick them up. Any questions you want answering, please do. I'm very happy to take any questions and I can include them in the video. But for now, have a lovely evening. Bye-bye. Hello. Sorry, it's been a few days since I did another video, but not much has happened in the past few days. So it's Sunday the 14th of March, it's Mothering Sunday, Mother's Day, whatever you want to call it. This is my first one, it might be the first one for a lot of you. And I had the pleasure of having a nice lie-in and sort of doing what I wanted to do, really. So I got to play a bit of my game, read a bit of my book. I'm reading Grapes of Wrath at the moment. Don't know if any of you have read it, it's quite depressing, but anyway. So yes, on Friday I was supposed to go to an ERCP list, but unfortunately there wasn't actually one on, so I ended up revising and then sat in a webinar talking about non-alcoholic fatty liver disease, which turned out to be really interesting. And one of the nice things about medicine is you're always learning something new. So one of the things I learnt is that we should be doing active cardiovascular assessments and starting a statin if they're at high risk. So it's something I can start using in my practice. One thing when it came to Saturdays, I realised that my weekends mean something again. So because of COVID and the lockdowns and having to stay in all the time, it became a bit like Groundhog Day. And now the weekends actually mean something, and it was nice. I feel like I've got those 2 days to myself. I do spend some of that work, doing some revision or playing my game or reading my book, spending some time with Lily. So it's really nice. So there isn't really much to say apart from that. This week's going to be slightly busier, I think. There's quite a few meetings and webinars and things I'm getting involved in, but I'll keep you updated in what I'm doing. As always, please comment if there's anything you want to know, or if there's anything I can do to make these videos better, please do let me know. And I'll be releasing another episode next week. So hopefully you can catch up with that. And I'll see you then. Bye bye.